My name is Alicia. Welcome back to another episode of Mom Talks. This week, I was thinking we can talk a little bit more, maybe get a little bit into healthcare bias, but more so advocating for yourself within the healthcare system. And one of the ways that I plan on doing this is through a birth plan / birth preference. One of the things that I do plan on doing is right at the top is that I am a person who stutters. So while I do plan to also tell my nurses, and of course, my doctor, her office, her staff, they already know all this. This is something that we've been through, at the hospital when I give birth, hopefully very soon. Well, I do plan to tell my nursing staff, hi, I'm Alicia, nice to meet you. By the way, I am a person who stutters, and I would just like for my time to be respected. I understand as well as a person in labor, my thoughts and probably opinions won't always be kind of coherent. Like I can see that happening, as you're kind of going through a contraction. Like I'm sure there's kind of might just naturally be that vocal disconnect. But I would just like for you to keep in mind that I am a person who stutters, and I would really appreciate it if you would let me finish my sentences before you speak or before we head on to any part of the conversation. Personally, I'm generally very good about if people overspeak, if they speak on top of me or they cut me off. I usually have a very good temper and I'm very polite in saying, hey, like I wasn't even speaking, or hey, I'm a person who stutters. But I think, the situation self-disclosing would be the best, especially because I realistically do not know how I'm going to react to when I am actively in labor. And I handle pain very well, but it's a different type of pain. And while I do have a very good temper in dealing with people who speak over me, I know myself, and in regular situations I can get very frustrated. And so I know just changing the situation, dialing it up to a 10, I would like to avoid those situations. One of the ways that I plan to avoid just completely losing my cool or just being overstimulated, and the fact that people aren't listening to me and so much is happening at the same time, I plan to, one, tell my nurses, self-disclose, hey, this is okay, sorry. This is who I am and this is how I feel about this. I also do plan to put that on paper. I am a person who stutters, and I would like this, that, and the third. Also, I think if you're comfortable with it, writing it down on a piece of paper, if you're not yet comfortable self-disclosing, is a good way to just like get it out in the open, if that makes sense. Like if that's still something that you are hesitant about, having someone read it might be easier. That was this episode of Mom Talks. Thanks.